Hi, my name is Rachel Beisler and I will be talking about lower limb amputation. Lower limb amputation is the surgical removal of all or part of a leg. There is a major amputation, which is any amputation performed above the level of the ankle. There is a foot amputation, where the amputation is at or below the ankle. And then there is a primary amputation, which is an amputation performed without an attempt at limb salvage. There is a secondary amputation, which is an amputation following a failed attempt at revascularization, and there is a traumatic amputation, where the limb loss occurs in the field of time of injury. An amputation can occur at the hip, above the knee, at the knee, below the knee, and at the ankle. The most common cause of limb amputation is poor circulation because of damage or narrowing of the arteries, which is peripheral arterial disease. Without adequate blood flow, the body cells cannot get oxygen and nutrients they need from the bloodstream. As a result, the affected tissue begins to die and infection may set in. Other causes are severe injury, either from a vehicle accident or serious burn, for example. Cancerous tumors in the bone or the muscle of the limb, serious infection that does not get better with antibiotics or other treatment, thickening of nerve tissue, which is called neuroma, frostbite, end-stage renal disease, poor functional status, and diabetes. This pie chart shows that 71% of amputations are caused by diabetic gangrene, 7% are caused by non-diabetic gangrene, 11% from trauma, 1% from infection, 7% from tumors, and 3% are not indicated. Amputation of the leg is the most common amputation surgery. 71% are below-the-knee amputations, which is the most common. 185,000 new lower extremity amputations each year within the U.S., and an estimated population of about 2 million Americans are amputees. Of the approximately 1 million unilateral lower extremity amputations due to dysvascular conditions, the most common were toe at 33.2%, transtibial at 28.2%, transfemoral at 26.1%, and foot amputations at 10.6%. Asians were found to have a lower relative risk of lower limb amputation, while African Americans have a higher risk. Men more frequently require amputation than women, especially for vascular disease. People with diabetes are anywhere from 8 to 24 times more likely to undergo a lower limb amputation than people without diabetes. This pie chart shows that 88% of limb amputations are unilateral and 9% are bilateral. Treatments include compression garments. Compression garments help with swelling and they help with the shaping after surgery. There's also rehabilitation. Physiotherapists will help maintain mobility and muscle strength of the leg, and they will also teach the amputee how to use a prosthetic leg if they have one. Another treatment is prosthetics. This depends on the type of amputation, the amount of muscle strength in the remaining section of the limb, general state of health, tasks the prosthetic limb will be expected to perform, and wanting the prosthetic to either be cosmetic or functional. Another treatment is stump care. The amputee will keep the skin on the surface of the stump clean to reduce the risk of it becoming irritated or infected. They will also apply heat and ice packs, massage it to increase circulation and stimulate muscles, acupuncture to stimulate the nervous system and relieve pain, and transcutaneous electrical nerve stimulation, which delivers electrical impulses to the stump to block or reduce pain signals. Having a leg amputated will affect exercise. The energy cost to move is greater for amputees than for non-amputees. Ascending level of amputation appears to be associated with increasing metabolic demand. They will also have decreased balance and an increased need for trunk strength and stabilization to compensate for the missing limb. There are many benefits to exercising for a leg amputee. Exercise will give the amputee more energy to help with their higher energy expenditure. It will also heighten their metabolism to help prevent weight gain. Exercise will build muscular strength in their full leg, residual limb, and core. Amputees who have diabetes, peripheral vascular disease, or other chronic medical conditions become deconditioned from being sedentary. so it's very important for them to maintain a level of activity regardless of if they're going to lose their limb or not. Exercise will also help prevent future possible amputations due to those medical conditions. Early exercise after amputation surgery can help them avoid painful contractures or deformities of the joints or muscles. Common medications for lower limb amputees are non-steroidal anti-inflammatory drugs, including ibuprofen. Ibuprofen eliminates skeletal muscle adaptations that occur during or after exercise. Another medication is anticonvulsants. This includes carbamazepine and gabapentin. This causes problems with balance and coordination. Another medication is antidepressants. This includes amitriptyline and nortriptyline. This is known to cause joint pain, muscle aches, dizziness, and decreased balance, which can significantly increase one's risk of falling during exercise. These drugs can also cause excessive sweating, which could lead to dehydration. Another medication is opioids. This includes codeine and morphine. This changes your heart rate and rhythm. Some people find that their heart beats more slowly and irregularly when they take opioid medications. It also causes reduced endurance. Opioids slow down your breathing and your heart rate. When you breathe less, you take in less oxygen, which means that less oxygen is available to your muscles. Another medication is corticosteroid or local anesthetic injections. This can cause muscle weakness. My case study was on Allie. Allie is 40 years old, her BMI is 20, resting heart rate is 70 beats per minute, and she has her right leg amputated above the knee due to a trauma from a car accident. She is apparently healthy and wears a functional prosthetic. She stays physically active but does not engage in regular exercise. She takes ibuprofen and gabapentin for pain management. She hopes to strengthen her core, residual limb, and full leg. My exercise prescription for Allie is to perform resistance training 2 to 3 days a week. This should be performed at her 60 to 80% 1 RM max. She should do 8 repetitions and 2 to 3 sets of each exercise. She should perform at least 2 body exercises, 1 core exercise, and 2 lower body exercises per session. These should include multi-joint and compound exercises that focus on her major muscle groups. She should do free weights, machine, and body weight exercises. Allie should train aerobically 4 to 7 days a week. Her target heart rate should be 114 beats per minute and 158 beats per minute. This is 40 to 80% of her heart rate reserve. Each session should last 20 to 40 minutes. Her session should include swimming and walking with prosthetics. Swimming is great because it's low impact for her joints, and walking in a prosthetic will help her muscles form to her prosthetic and get her used to walking in it. Allie should work on her flexibility and balance 4 days a week. She should stretch till slight discomfort or tension. She should hold her static stretches for 15 to 60 seconds. Her dynamic stretches should last for 10 minutes, and PNF stretching with a 6-second contraction followed by a 10 to 30-second assisted stretch. She should do static stretching, dynamic stretching, and PNF stretching. She should also do balance exercises that focus on movements that incorporate her prosthetic. So Allie should be able to perform upper body and core exercises and lower leg exercises with consideration of prosthetics normally. She should avoid activities that promote friction between her amputated limb and her prosthetic. She should also prevent contractures by performing hip flexor stretches and adductor stretches. She should also emphasize stability exercises. All exercises should be performed with her prosthetic on to train her muscles. Allie also needs to prevent her hip from staying in a bent or flexed position. To prevent it, she should frequently change the position of her hip. She should not sit in a chair for a long period of time. She should lie on her stomach for 20 minutes 2 to 3 times a day. She should not place a pillow under her stomach while doing this. She also should not place her amputated leg on a pillow while laying down. She should also not place a pillow under her hips, knees, or between her thighs. She should avoid hanging her stump off the side of her bed. She should also stop any exercises that cause pain. There should be no sharp pain or burning in her residual limb during exercise. We will need to check her residual limb often for redness and signs of pressure. Some stability exercises that she should perform are prosthetic leg balance, leg swings, prosthetic leg clock with arms, clock on an unstable surface, one leg squat, single leg deadlift, the hollow man, a plank, a bridge, and the Superman pull. Stability exercises will help free her from lower back pain. It will help the prosthetic feel more comfortable and natural, and it will help strengthen stabilizer muscles in her core, leg, and residual leg. When exercising, a towel should be kept on hand for perspiration between the residual limb and prosthetic. Extra stump socks should also be kept on hand during exercise, since limb volume may change with muscular contractions and weight loss due to training. We want to ensure that her prosthetic is always fitting comfortably. Since Allie is relatively healthy and has been physically active before her exercises, she should be fit for a running prosthetic to further her exercises instead of only walking and swimming to train aerobically. Continuing to progress Allie's exercises and training will not only benefit her physically, but also mentally. It will help her with her confidence and mood. Her quality of life will improve as a whole. Here are my references. Thank you for listening.